Good evening, everyone. I'm really happy and fortunate and overwhelmed to welcome Dr. Kaustabh Adhikari, who has secured an AML rank 4 in this year's INISS SS in clinical hematology. So, welcome aboard, Dr. Kaustabh. So,
Thank you, sir.
firstly,
This is my pleasure to be here speaking to you.
same here. Firstly, congratulations. It's a difficult exam, and I've gone through it a few years back, so I understand how relieved you must be feeling where you are at this position today.
Yes, sir. Indeed,
So,
sir. It's like a huge relief. Thank you so much, sir.
so Kaustubh, can you tell us about yourself as to where you are from, where you did your UG and PG from?
Sir, I'm basically from a small town of Dhuburi, which is in the Jalpaiguri district in the northern parts of West Bengal. It's in the foothills of the Himalayas, very close to Darjeeling and the Bhutan Hills. I did my MBBS from North Bengal Medical College, which is also located in Siliguri. And from there, I came to Delhi and I did my postgraduate in as an MD medicine in RML Hospital, Delhi. And after that, for the past 8 months now, I have been working in Safdarjung Hospital in Delhi as a senior resident in the hematology department.
So, you've been from the most beautiful part of the country, so to one of the sort of polluted parts of the country. And why did you choose hematology? You know, clinical hematology is not as luring or as famous as cardiology or gastroenterology. Why? What made you enter this field?
So among most of my friends, it was a general tendency to go towards cardiology, nephrology, or gastroenterology. But sir, I'd like to take this moment to share with you the experiences that I had. Actually, I myself, when I was in my 10th standard in school, I was around 16, 17 that time. I had severe aplastic anemia, which is a bone marrow failure syndrome, and I had all my blood counts, RBCs, WBCs, platelets, everything used to go down, and I suffered for that with that for around 8 to 10 months. After which I underwent bone marrow transplantation in CMC Vellore, and that was back there in 2011, 13 years from now. And my sister, younger sister, she was the donor, and she is also incidentally currently studying an MBBS course in a third year of MBBS. But the thing is, at that time, I saw a lot of hematologists around me. I saw a lot of hematological cases around me. I myself went through that. I had severe retinal bleeds, vitreous bleeds in both my eyes, and I had been blind for 3 months. So after that, I recovered from there after the bone marrow transplant, had some eye surgery, despite having some uh, problems in my left eye, central vision also. But fortunately, by grace of God, I entered into MBBS then. And at the back of my mind, I always wanted to be a hematologist. The people I saw there in the worst of my days uh, became the best of my memories. And then after MD, actually in RML hospital, I did not get a lot of exposure of hematology because there wasn't a department there. So after that, I thought that I was driven towards hematology from an emotional point of view. But as a professional, dealing with cancer patients and really sick patients day in and day out, I didn't have an idea how it would be, how it would feel like. So I wanted to have a first-hand experience of hematology as a clinician, and so that I joined Safdarjung Hospital, which is a very beautiful hospital, uh, very good clinics and academics, and we do have bone marrow transplant also here, and under the guidance of Dr. Sumita Chaudhary, Dr. Ankur Jain, Dr. Aditi Jain, ma'am. I fell in love with the subject again, and most importantly, the patients. I could connect to the patients, and I could see the patients, and I could feel with them, and got reminder of my days in the past. So this journey of hematology had been very beautiful for me. Sorry, I think I may have become emotional and oversaid, but that's why hematology, sir.
Kaustabh, it is, I mean, I've come across many students, many interviews, and to be honest, this is one of the most inspiring stories I've come across. And this is not because I'm just saying because I have to say this, but from being a person who has been a patient or is being more or less like on the receiving end to come on the other end with all the hardships we face through physically as well as probably mentally to a caregiver and to reach a stage wherein you have cracked the super specialty entrance, that one of the most toughest entrance exams of INS super specialty. It is indeed very good achievement. I'm really,
Thank
really
you, sir.
happy.
Thank you so much, sir.
So Kaustav, if you have to guide our future students as to how did you go about preparing for the exam, uh, and for any student, it is the medicine part as well as the hematology part. So, what was your approach with respect to medicine as well as hematology part for the INS super specialty entrance?
Sir, the medicine part, I would say that there are around 30% questions which come from medicine. But this time, the question was like uh, there were few overlaps between hematology, which we cannot demarcate between hematology or medicine. Few questions were like that. So in my MD days, the academics in my college was really good, and I had passed my MD exam in last July 2023. And most of the medicine knowledge that I had to recall for this exam was that knowledge which I studied during my MD days. And all those I and after that, after I entered into this hematology in the as a senior resident, I was quite new to this branch and I did not know much about hematology. So most of the learnings, most of the readings I had to dedicate to hematology, not just for the sake of entrance exam, but for actually fitting into the ward work and doing my job properly. So my preparation for this exam, this INISS exam was mostly hematology based rather than medicine based, because medicine, truly speaking, sir, I did not have any time to or to revise the medicine at all. Whatever I answered in the medicine, I had to recall back from my MD knowledge, which was 8 to 10 months back. Regarding the hematology, sir, I studied from Marrow Notes, and Marrow Notes was mostly like the 90 to 95% of my preparation regarding the hematology. Sir, your notes only, solely, nothing else. And I had been told by my seniors about the ASH SAP. I got that book also, but I did not get much time to read. I barely read one or two chapters, but still couldn't revise them. And regarding questions also, I did not solve many questions. What I did was, in my postings, I was fully into the thing. I was kind of trying to absorb everything which my consultants say, which come across, and I used to sit with the consultants and discuss every case with them in the OPD. So that helped me a lot. So regarding practice sessions and questions and tests, I am very much behind actually. I did not give a single test, but that ward work actually I feel helped me a lot. I couldn't even complete the syllabus of hematology before going into hematology exam.
Right. That just goes to show as to if your medicine knowledge is strong and we've worked in the wards enough to gain some ground knowledge along with uh, the hematology notes which you referred to. Probably it's in a way a wholesome preparation, but that also underlines that if possible, we should give the test because that just helps you to revise as much portion as possible. Now,
Yes,
you
sir.
were
Yes, sir.
working as well as preparing. So,
Yes, sir.
approximately how many hours a day you were able to study hematology during your residency?
Sir, some days in my job was like 9 to 4 every day, but some days it used to extend till 5:30 also, few days. And after coming back, I studied in the normal times. I studied maximum for 2 to 3 hours, not more than that. And some days I used to feel very physically burnt out, and some days were emotionally burnt out because I saw many kids relapsing back and coming, and I used to feel very bad, and all those days I couldn't study at all. And it was, and before the exams, I studied maybe for 4 to 5 hours, maximum 4 hours, sir. Not more than that. But before the interview, my department was very kind enough to give me some unconditional leaves. I studied very much before the interview, like maybe for 12 to 16 hours, 12 to 14 hours a day before the interview.
And approximately how many months of preparation you feel is adequate or okay for a person
So
who's
two to
aspiring for
three months is
hematology?
fine, sir. 2 to 3 months, if you have some baseline knowledge, like if you are learning from the wards as well. But if there is no practical or first-hand knowledge, then I think 4 5 months is required.
Right. And if you have to grade the difficulty level of the INI exam this year, how will you grade it as?
Sir, the core hematology part, which was asked there in the theory part, in the MCQ part, it was, I would rate it around. I would rate it easier compared to the other INIs. Last year also I sat in the INI exam, but that may be biased. I may be biased because I work now and I felt that it was easier. But maybe it was, if last year's was 4 out of 5, it was 3.5 or 3.2 out of 5 difficulty level this
Okay.
time.
And how many questions did you attempt in the exam?
Sir, I think I left 5 questions. 74 or 75 questions I attempted, as far as I remember.
So out of 80, you attempted 75. Right. And
Yes, sir.
uh, once you got selected for step two, how was your preparation for the interviews? Because that is what the students actually dread. They feel that the interview is more difficult than theory, which in reality it not actually is.
Sir, when I saw my name in the list of the 13 people who were selected for the uh, interview, I couldn't believe myself. Actually, I didn't think that I would get selected for the interview. That was the moment I thought that I should have worked more on the theory part. And if I don't get selected this time, that will be only for me being complacent on my theory part. So uh, actually preparing, focusing on the theory part is the most important, because the interview after that I put all my efforts in my interview, and that was a 10 minutes interview that happened. And for that for the interview part, sir, I attended the webinar that you hosted. And from that, sir, it was of much help, because I got a spotter from a reverse yellow sign of fungal of mucormycosis, and that was exactly from the photos that you shared there. And herpes zoster, I also made some list of the topics that they are generally asking from the AIMS pass out consultant in my hospital, Dr. Aditi ma'am. She is there, she helped me a lot. She gave me a list of the things mostly. And also Paras sir, who was there as an SR here, he is currently doing DM in PGI Chandigarh, DM hematology. Sir, most of the things which they ask are the basic things. They just ask you about whether you have some knowledge about the basic hematological patients that come to you, their gravity of the disease, and if you are left to the ward, left to the patients, you can manage them adequately or not. Like the first question they asked me was, "What are the cases that you have seen in your ward?" And then sir asked me, if you come across a patient with acute leukemia, how are you going to manage that patient? How are you going to approach that patient? So that was a very open-ended question. Like we have, if you have some experience in working, then it will be of very much help to you. Uh, you can say it very systematically, and by hearing those answers, they understand that you have worked in that field and you can manage the patients. They also asked me some Basic questions like if I did bone marrow, and in bone marrow, which vial to send this flow cytometry, and can I send flow cytometry in heparin vial or not? Basic questions like these. They just test us whether we have worked in the wards or not.
Agree, agree. I couldn't agree more with this. That's what it is important for our residents or students to understand. You don't want to test your hematology knowledge. You just want to test your basic medicine or pediatric knowledge so as to know whether you are a suitable entrant for a super specialty field or not. That's what. And Kaustubh, lastly, if you have to give any message or piece of advice or words of wisdom for future aspirants, what would you give them?
Sir, sir, first of all, I would like to say that if someone wants to do DM, then only just go for DM. Otherwise, if someone is happy with medicine, that is a very beautiful thing to do. Just because others are doing DM, there's no point in just going for a DM. And also another thing is that it's better to have some idea about what subject you want to go about. And if it takes some time also, then please go and do SRship in that respective subject and see that you connect to that subject or not. Because last time NEET, what happened is I saw many of my friends, they brought excellent marks in NEET, and but they were very confused as during counseling as to which branch. Some people gave in the first option, they gave some gastroenterology. In the second option, in the second choice, it was cardiology. So that creates a lot of, I felt very sorry for them because they were very tensed at that moment because that was a decision for their life. So it's better, like, we can take it slow, there's no harm, and we don't have to rush through everything. We can go and work, or we can read the subject properly. Even if we don't work, we can understand the thing, we can deal with the patients, we can take some, I personally feel that we can take some break after PG, because it's a very hectic thing. We can just chill, and even after chilling also, if a student like me could get through, sir, everyone can get through. So it's not a big deal, like it's, we should take it easy and happily. Sir, I
Completely agree.
another thing is, sir, I would like to thank you, sir. Like, your videos and your notes, they were so good. Like, I'm not just saying about the INISS interview or the examination. Everything that you made us write down, like the indications of adding gram positive coverage in febrile neutropenia, those were questions that my consultants asked me day in and day out, and those were the decisions that I had to take in my ward. APML was such a beautiful description, like the how, when to start the hydroxyurea, when to start the steroids, differentiation syndrome, when we, all those practical nuggets that you shared with us. And also, sir, I would like to appreciate your endeavor in bringing the history of hematology into the notes, so that we can understand how chemotherapy came, how this came, that came, and all the history part. It's amazing, sir.
Thank you. I'm flattered today. So if someone who is really wanting to enter into hematology, and if he wants your advice as to what should be his focus for the INI entrance of November 24, what will you advise? What will you tell him apart from working into hemat, which maybe he must be
Sir,
doing, or he or she must be doing.
INI, this time, sir, there are a few questions from, I feel INI has a huge stress on coagulation, something which we sometimes see. Sir, I feel that leukemias, everyone will read. Uh, Leukemias and anemias, everyone will read. But specific things like autoimmune hemolytic anemia, then coagulation disorders, including platelets, and most importantly, the treatments of the hemophilia with inhibitors and all those things. They are very fond of that. And TTP, many questions from TTP was asked this time. DIC, TTP, all the emergency kinds of things that hyperkalemia, emergency management, those are quite asked, sir. So those are the things that have to be, sir. I feel that the marrow notes is sufficient, and the marrow notes should be read thoroughly. I don't find anything to be uh, removed from there actually. Like, there is although I pointed out some important things which are here, these should be stressed on, apart from the main leukemias and the lymphomas. But I feel if one does the marrow notes completely, then it is more than enough for even cracking the exam, and also the residency. I think that is more than enough. But we cannot compromise on the marrow notes. Whatever part I read, like almost 10% of the marrow notes, 10 to 20%, I could not end up finishing. But the rest of the 80 to 90%, I read very thoroughly, and I did not read anything else. I am a bad example that I did not give any grand tests or any tests or solved questions, but still I would like to reiterate that the notes were so good and the questions, sir. I also attended your recall videos of the INI, and about INI, sir. I would like to re-emphasize on the role of repeat questions and repeat topics. So many questions were repeats, sir. Questions were repeat and topics were repeated. So if you read, focus on those very topics. So those are your common questions that are going to come. Nothing else. They 80% of the question will be from those common topics, and 20% questions you read. If you can't answer also, then it's fine. My marks was 67, I think 67 out of 100, but still I secured a rank 4, so it's fine.
And how many times, say, you were able to go through the Marrow videos again, say twice or thrice, or do the notes
Sir,
again?
videos I watched only once, but during the videos I took the notes extensively. Like I used to pause the videos and write down every possible thing that you said, and that would help me understand the thing, because the notes the notes can be made concise also. If anyone can remember concise note is fine, but for me I write down every single line and story and everything behind that, so that I took time in making the notes, but I didn't rewatch the videos. The notes were so elaborate that when I watched the notes, everything came back to my mind about the videos, what were taught. So notes revision, some important topics that were in the recall videos, those topics I may have read for twice or thrice, and some important leukemias and all for my ward management, I had to read 5 6 times. Those things which are regularly seen in the wards, I read them for 5 to 8 times. But those are purely theoretical things. Maybe 1 or 2 times I revised.
Right. That summarizes it very well, and it was straight from the heart, Kaustav. So, uh, thank you very much for being here today and sharing with us your experience of how you went through this. And I hope to cross paths with you sometime soon.
I hope that too,
Best
sir.
of luck.
It was my pleasure to meet you, sir. And the notes, the endless number of hours I have seen your face in the videos and taken down the notes. I can't believe that I'm talking to you face to face. This is a huge pleasure, and this is a huge day for me, sir.
Thank you very much. I hope Marrow will be of helpful to many more students like you in the
Yes, sir,
future.
definitely. Thank you, sir.
Thank, thank you.